I would have gone all in had there been other people like me before me
Yeah.
who could have
Yeah.
helped me to understand, like, hey, wait a second, like you're actually like poised to make more money here than grinding away in the clinic. I couldn't see that because of how, how the institution trains us, just working in the profession, how, what we're exposed to, what we're, how we're led to believe, and the sandbox that we're supposed to stay in, the track where we're supposed to be. I couldn't see that, wait, I've actually got a really good thing here. I can go all in a lot sooner than I thought.
Hello, and welcome to Good Outcomes with Dr. Dave, where we believe that better outcomes don't come from better luck, they come from better questions. In this episode, we're going to talk about the healthcare system. I personally believe that the healthcare system is fundamentally broken, and I believe that healthcare insurance companies are a large reason why it's broken. And I think a lot of physical therapists know it, but they don't necessarily know what to do about it. Today, we're talking about the system, why it's broken, and what some physical therapists are doing to create better outcomes in their space. Today, I have with me David Bailiff, who has over 30 years experience as a licensed physical therapist. Originally from North Carolina, moved to Arizona in 1994 where he began his practice. There, he worked in a variety of outpatient clinics before launching his own mobile concierge practice in 2013. In 2020, David co-founded the Uncaged Clinician coaching business for physical and occupational therapists looking to make the jump into entrepreneurship. David and his wife, Cara, moved to Frisco, Texas in February 2025. Today, he continues to lead therapists who are looking to build their own practice while seeing clients in the area. David, thank you so much for joining me today. Welcome, welcome.
David, this is a great honor. Truly is an honor to be here. I'm excited for your show, but I'm excited for more people to really learn about you and how you are impacting the community and the surrounding areas and in the way that you're doing it. You and I, we've known each other for a few years now, and I've always admired how you do things. So I'm excited for you, brother.
Thank you. Yeah, this is truly a lot of work coming into this. So here we are finally launching the podcast in a way that I hope is beneficial and edifying, not only to clinicians, but also to clients. And one of the things that I wanted to bring up with you first, though, is that you were a mobile concierge physical therapist in 2013. That is extremely early because this is now becoming a lot more popular, a lot more well-known. People are starting to realize that they can pay out, outside their insurance for their physical therapy services. But you were doing this probably one of the first. Tell me what prompted it. Tell me what started it. How did you do it? A couple seconds here, a couple minutes here. Tell us where you went, how you did it.
Yeah, honestly, I was, as you said, I was working in a variety of outpatient clinics for a number of years, 19 years. And I had been a clinic director in the past, didn't like all the responsibilities that came with it, and just the side effects of requiring that much time were not healthy. The clinic where I last was employed, I was standing there one day thinking, man, I do not want to be a 50-year-old staff clinician. I knew I didn't want to be a clinic director with this particular company. I didn't want to be a staff clinician either. I didn't know what to do. I didn't know what I wanted to do. I knew I didn't want to open up my own clinic and do insurance because that was part of what I was wanting to get away from. And then I had a concierge physician in town who I was seeing a lot of her clients. She reached out to me and she said, hey, you've been seeing my clients in the clinic. They all like you. I have a guy. Would you go see him at his home? He's been to the clinic settings. He does not like it. He wants someone, he likes for everybody to come to him. Would you do that? And of course, at this particular time, this was 2011. And I said, well, never heard of that, never done that. Okay, sure. And so I went and I saw this gentleman during my downtime, walked out of his house the first time seeing him, realizing I know what I need to do. I know what my move is. And I did that as a side hustle for about 1.5 years, 2 years. And then, as you said, 2013 went all in with my practice. But having it introduced to me, realizing like, hey, there's a population of people who actually, they want higher care, or at least if nothing else, they want it to be about them. They want the convenience and they're willing to pay for that. And I was just blessed to be kind of in the right place, right time, blessed with doing good work, paying attention to the people in front of me as we should be as clinicians, we'll probably talk about how that has led to a lot of burnout or something. But just really paying attention to what I should have been doing in the clinic, needed to be doing in the clinic, opened up another door for me that I didn't know was there. Nobody knew that it was there. So that was really kind of my segue or my entry point, if you will, into doing mobile.
So it sounds like you were discontented with the system,
Yeah.
and then a door opened and you just walked through. You're like, well, I'm going to go for it. And it took you about a year and a half to, get yourself together. But then you kind of launched on your own, and you had to have been successful. Did you ever end up hiring anybody during that time?
I did at numerous times. I had a couple of 1099 employees who would see some visits for me. I was at the point where, I don't want to get ahead, but I was at the point where I was going to bring someone on at least 1099 a little bit more permanently. And then COVID hit and my caseload, just crashed. But for me, and we'll talk about that probably in a little bit, it was actually a blessing for me because of some circumstances. But in the time, I did have a couple of 1099 employees for me who saw some visits for me. And yes, it took me a year and a half, a couple of years to go all in. And honestly, David, I would have gone all in had there been other people like me before me who could have helped me to understand, like, hey, wait a second, like you're actually like poised to make more money here than grinding away in the clinic. I couldn't see that because of how the institution trains us, just working in the profession, what we're exposed to, what we're, how we're led to believe, and the sandbox that we're supposed to stay in, the track where we're supposed to be. I couldn't see that, wait, I've actually got a really good thing here. I can go all in a lot sooner than I thought. So that was really kind of the reason for the gap there.
Yeah, well, you and many others trailblazed for a lot of us. And it's funny, I have my own COVID story. I started my practice at the beginning of 2020 in January, saw my first patients in February. And then my company, it was a home health company, found out about it. And they didn't like that, apparently. I wasn't taking Medicare or anything, so it didn't matter to them because it was all Medicare-based. And March 9th, I was fired from that job. And it's like, okay. And then obviously a week later of 2020, everything shut down. And, it's interesting because I know you ended up pivoting around that time. I was launched during that time. I was full in 3 months. And it's all the favor of the Lord, in my opinion. And I'm sure that there is testimony in your story as well about the goodness of him. So speaking of which, you pivoted to the Uncaged Clinician coaching group about that time. And can you just tell me what you mean by uncaged? Because I actually wear your swag quite often.
Well, first of all, thank you for wearing the swag. We appreciate that. And then
send me more.
Hey, well, it's in the mail. Uncaged. First of all, I just want to say this: we're really proud, I don't. Not you know where I'm coming from when I say proud. We're proud of the fact of the name, in that we see people excited to announce, hey, I'm going uncaged. We don't see them saying, hey, I'm jumping all in, or I'm doing this, or I'm another name. We see themselves saying, I'm going uncaged. And I think first of all, it's just a name that really resonates with people, because what uncaged means is, again, I kind of alluded to this earlier, that I think throughout the educational process, even though we are trained to work with people in a variety of ways, multidisciplinary, take people through exercises, everything, at some point, somehow, it's kind of just assumed that what we are to do is we are to learn our craft, learn it well, and be an implementer, be an assembly line worker, go work for someone else. Throughout the educational process, it's not talked about, entrepreneurship. No, people who owned clinics, they were like a different breed, and they weren't spoken about, and so we are taught to just get good with your hands, get good with exercises, and take Con Ed courses. And the more that you learn, then you'll make more money, because you can see more patients, because you'll get them better faster. So you can see more patients, and that's how you'll make more money. And so there's a lot, as you know, Dave, there's a lot of frustration that comes with working in a high volume clinic, particularly, outpatient clinic. And so uncaged means that, hey, basically we are taking everything that the educational process said, hey, here are all the things that you can do. But instead of where at some point they said, hey, you can do all these things, but you're going to focus only on in this lane right here.
Yeah, I feel like uncaged, it means two things to me. One, getting out of the cage of what the physical therapy schools have boxed us into.
Yes.
And then also what the insurance companies have boxed us into.
Exactly.
And honestly, when a physical therapist is uncaged, the potential for healing for clients is also uncaged.
Absolutely.
And I think sometimes the buck against, I have to pay out of pocket for physical therapy is, a little bit a negative for patients. But what really, you actually get what you pay for, because you still got your copays. Some people have lots of high deductibles they have to go through anyway. But the potential for healing is also uncaged for our clients. And I think that's really important for people to recognize.
Absolutely. And you're a perfect, you're a great representation of what is uncaged, not only with your practice, but the fact that you're doing this show and the fact that you are providing service education to not only other clinicians, but perhaps to, your audience, potential customers as well. That's an example of being uncaged. In fact, in answering your question, I'm reminded of the picture that's right behind me here that kind of defines what is an uncaged clinician. It's the courage to blaze a new path, committed to a higher standard of care, and the confidence to pursue success. And a lot of us, it's not so much that we are, I think a lot of people, they say they're afraid of failure. I think they're really more of afraid of pursuing success, or they don't have the confidence to pursue success simply because they don't know how to pursue success. It's not a knock on anybody. We're just not taught how to pursue success. So again, it's the courage to blaze a new path, committed to a higher standard, and the confidence to pursue success. That's really what an uncaged clinician is. And being willing to recognize, like, hey, there's a lot that we can do. I kind of like to say that, and I've said this story a lot of times, we're taught, we learn a lot of things, like we learn about the playground, but then we are taught, okay, now the playground, you're supposed to stay in the sandbox. And meanwhile, people like yourself, you're standing in the sandbox going, well, but look at that swing set over there. Look at those monkey bars. Like, can I go play on those? That's part of the playground. And for some reason, we're told, no. Stay here, get your shorts full of sand, whatnot. But I want to go over there. And so it's having just the courage to go over there and actually swing on the swing set. It's still part of the playground. It's still part of what we've learned to be able to do. It's still part of being a kid, all right, without getting in trouble. So that's kind of like, uncaged is just having the freedom to be creative, to use what is totally within our scope of practice and what we learn to influence people's lives. If I could say, I think Uncaged is moving beyond labeling ourselves or seeing our identity as being a physical therapist or a occupational therapist and doing physical therapy or doing occupational therapy. It's looking at it at a deeper level.
We're impact. It's all about impact.
Yeah, absolutely. What is the impact? I mean, yes, you, myself, we might use the skills and knowledge of physical therapy to change people's lives, but really, what is the impact on a deeper level? And do we think about that?
And that's actually where we get the fulfillment from. Is I know you and I, we share the same Christian faith. The reality is that the impact is not just for ourselves. It's not even for our clients. It's for the kingdom that we love and serve.
Absolutely.
And and so with that, let's get into why the system's broken. And I will tell you, I do not have to tell my patients that the system is broken. When they come in, they already know it's broken. And I actually built a whole business model based on the fact that it's broken and solving the problem with which they already know exists. And so with that said, I want you to tell me, What's the number one reason why you think the physical therapy healthcare space is broken? What is it? And then we'll get into what to do about it. But what's the main thing that you think is the limiting factor for us?
Yeah. Well, first, I just want to say, as you said, people coming to you and they already know that it's broken. And you have done a very good job of clarifying your message where it's resonating with them. Oh, they know the system is broken. And they're saying, yeah, you know what? Here's a guy that is solving the problems. And it goes into, well, why is it broken? What problems are we solving? Well, it's no, I've been a therapist for over 30 years. I've been around the profession for pushing 40 years. I've never seen reimbursement rates go up. They've only gone down. Okay. Reimbursement has gone down. And again,
why is that? So what you're saying is, let's be clear. What you're saying is that reimbursement rates in 1994 when you started were X. And then since 94, even with inflation, you're saying that insurance companies are paying less and less and less per unit, per hour of time or whatever every year since then.
Absolutely.
Okay, let's just be clear about that.
Absolutely. And now someone might say that, there were some things that happened more of like about in the 70s where insurance used to reimburse full 100%. And they never questioned it. And then all of a sudden they said, hey, wait a second, we're not making all the money here. And so they started making cuts. Now, in today's world, there are places, depending on where you are, there are places that insurance might reimburse $70, might reimburse $85, might reimburse $200. But when we look at where those numbers were 30 years ago, right, then overall, with inflation and everything, we don't see a change. There, I mean, in some instances, there's a percentage that's constantly cut, but if we really took it as a true cut, then by now, like the insurance would be paying us like $5 a visit if we really looked at true cuts. So I don't want anyone to think that like, wow, used to insurance, they reimbursed, $800 a visit. And now they're down to $125. No, they've always been in a range, but they make those cuts. And so it's kept them low.
Well, I was going to say, it seems like, we have the reimbursement going down, but we have the cost of education going up. We have, cost of living going up, materials, and even now compared to when I started this practice, salaries actually have gone up quite a bit in the last 5 years, and I think a lot of it's because of the demand. Our profession, I don't think, has always been the most lucrative, therefore it's not attracting the top talent,
right?
And so what we have is this dichotomy of like really expensive to run and really poorly reimbursed. And it sounds like that's what you're describing, is things are getting squeezed.
Things are getting squeezed. As you mentioned, yes, salaries the last few years have gone up a little bit because of demand. There was a period where our demand actually dropped. There were therapy schools that were outpacing the demand of the jobs. In fact, I even know of schools that they were struggling to meet quota of students because there just weren't as many applicants. But during that time, with, again, reimbursements being reduced, cost of living going up and everything, the cost of education you mentioned, the cost of education going up and up and up. I mean, when I graduated in 94, I graduated with a student loan debt of $30,000.
God bless you, man.
That's probably like for a unit now. Who knows? In school,
that was a year for me.
Yeah, but probably a year for you. That was my total debt for 3 years. And coincidentally, what we've also seen is that during that time, or at least up until about the early 2000s, mid 2000s, about a 30-year window, is that the cost of education skyrocketed, but the salaries creeped up just only gradually, only percentage points. It was I remember looking it up once, and it was like, education went up 300%, but the cost of salaries rose only 30%. So now when you get people looking at, hey, do I want to go in this much debt for that? That again, you're getting less applicants, but also because of that, now, the typical outpatient clinic, they're having to see high volume because of, I've got a buddy getting ready to open his own practice right down the street, and his monthly rent is $7,000 a month. So right off the top, that's $7,000 he's having to pay for rent. He's got his student loans to pay. That we have to be high volume in order to even make ends meet. And in that high volume, it creates burnout because, you and I, like so many others, we became therapists because we wanted to help people. We wanted to have an impact in their lives. We wanted to change their lives. We wanted to be tour guides for them, taking them on a journey. But we are then forced into a situation where it's all about just triage, putting out fires, slapping Band-Aids on people and running exhausted, and then having mounds of paperwork to do at the end of the day that I didn't go to school to be a writer. I went to school to change people's lives. And so we end up doing a lot of work that has nothing to do with what we actually went to school for. The government, if you will, has kind of stuck their nose in people's businesses of getting healthy.
Yeah. What struck me there was what you said about the journey. We want to take patients on a journey, and credit to Kevin DeGroot, your co-founder and partner,
Yep.
Business partner. When he was coaching me, he kind of described to me, you don't sell somebody on the flight to Disney World.
Right.
You sell them on Disney World. Now, sales, everyone says, is a nicky thing. I've said this before. I'll say it over and over again. I think sales is just merely helping someone make a good decision. Now, I believe I'm a good decision, but maybe I'm not the right decision for them, and that's fine. But our sales process is, here are your options. How can I help you get better, regardless if it's me or not?
Right.
And, Kevin helped me see that. And what's really cool is that, one of the things that's required of that is to actually have Disney World at the end, right? You can't just sell somebody on something and not get them to Disney World, because it's the flight, it's the journey that costs them. And it's what we are promoting, that like, hey, we want to take you somewhere, healthy living, being able to do certain things, no more pain, whatever the thing is, their goals. But the reality is that we need to actually trust that we know how to get them to Disney World. And we're trying to spread the word that it's possible in certain models and not possible in other models. And for example, I don't think it's very easy, and I think it's limited. I think it's caged inside the insurance model. And you're seeing how we're squeezed. What are some of the benefits of going outside of the model? What outside the insurance model? You described all these problems inside the insurance model. So what's the flip of that?
Yep. So going outside the model now, first of all, let's recognize something. Our customers, they are people, living beings, and no one is made identical. So that means that their bodies do not respond identically. They don't heal identically. However, with insurance, they put everybody into the same square hole, if you will, or round hole, whatever the saying is.
Same exercises, the same protocol.
Same protocol and the same time frame. Right?
Yeah, that's also true.
Same time frame. Everybody with rotator cuff repair, hey, you should be back to normal in 16 visits. All right.
16
or 12, whatever, Yeah. Well, the 16, that's after you've begged for a few more after the initial.
There you go. You got to beg for the 16.
You got to beg for the 16. Right?
Mm-hmm.
And insurance, well, what they want, they're all about making money. And I had an insurance. I learned that very hard a long time ago, before I even got into PT school. An insurance person telling me, like, hey, we're like any other business. We're in the business to make money, not spend money. And so they want to help people get back to a baseline, not even their past baseline, but to a baseline to where they can at least function. Like I said, to where they can function, not live their lives, not be better versions, but just function.
So you're telling me that they don't care necessarily about pain levels. They care more about whether you can do certain things.
Exactly. They don't care about pain levels. They care, can you get out of the chair? Can you make it to the bathroom? Can you perhaps drive safely? Can you carry in your groceries? Can you sleep? That's what they care about.
Even if it costs you a 5 out of 10 pain or whatever number you want to call it,
Yeah.
they're not really concerned about the pain levels.
Correct.
Because if you can push through the pain, then we're okay with this. We're not going to pay for physical therapy because it's all functional based.
Exactly. Just rub a little dirt on it, eat a stick of Big Red, and you'll be fine. If you want to feel better, go to the massage therapist. Okay. But we care, can you function? And for most people, that, getting to that level is not good enough. So what is the value of someone, of an individual saying, hey, I want to be in charge of my health. I'm willing to pay someone like Dave Harvitz to take me on that journey, to take me to Disney World. You mentioned Disney World. Insurance, what it does, it basically, it buys us a ticket into the gate. Buys us a ticket into the gate. If we want to ride the rides and all that, we're going to have to stand in a very long line. But nowadays, people don't, we're more impatient than that. We want more than that. So someone like a Dave Harvitz and his business, he says, well, hey, you know what? I'm going to get you that special ticket that takes you to the front of the line. I'm going to get you that special ticket where we don't have to stand in line for all the concessions. And we can get more than just the cotton candy. Like, we can actually get the good stuff.
Yeah, I say that a lot. As I don't think insurance tends to pay for what fixes you.
Correct.
And now in some cases, look, there are some patients that are out there thinking, well, I've gone to physical therapy, my insurance paid for it, and I got better. Yeah, there's a really good chance you would have gotten better without physical therapy at that point. I really believe
Very true.
There's a high percentage. Now, not every single one. And are there really good therapists working inside the model that are getting decent outcomes? Yeah, there are. But you're not going to get the hardest cases better inside the insurance model. That is for sure.
Right.
Because a lot of times it's not just the physical therapist that you need to be working with. If you're in severe chronic pain, or you've got certain conditions that need a multifaceted approach. And so, yeah, you're getting into the gate, but you don't really have any of the goodies. Right. And what's the point of being in there, watching everybody else do it and have fun, And so it sounds like, obviously, I think that it also speaks to the high volume. We don't have a high volume when it comes to us and with a self-pay model. Right. I think we do give that individualized care, like you alluded to with the cookie cutter approach, and and I think this is an Aaron LeBauer's comment and quote here, but he says, I don't work for insurance companies, I work for you.
Exactly.
Yep. And I think that's really important to recognize that when you're the one paying me, I want to make sure you're happy. But when the insurance company is paying me, I need to make sure they're happy. And when they're happy means that I'm doing what they want me to do. And sometimes that means a burdensome documentation. Maybe it's calling them and begging for more visits. Maybe it means working on function when really you care about pain. Like, that matters. And I think patients know the problem, but they don't know where to put their finger on or why it's even the case. And you've been seeing this for 30 years.
Yep. Absolutely. And it's being able to express that to the individual, to the customer. Hey, here, you may not be able to put your finger on it, but here's where the frustrations are. Here's why this is to your advantage for you taking control of your own health, is that we're going to fix the problem. We're going to fix your problem in a way that works for you and to take you where you want to go, and it be about you. We're not going to worry about, well, is this permissible by someone else who has no vested interest in you at all? They're just worried about meeting numbers for their investors.
Yeah.
So again, shackles come off, time limits, time frames come off, and it's more about people who are looking to go on that journey. And sometimes that journey takes a couple of weeks. Sometimes that journey takes 6 months, a year. Sometimes that journey is ongoing. Part of the insurance model, again, is, and I see a lot of clinicians struggling with this. In fact, there was a question just last week in our Facebook group. Someone was struggling with, they did therapy and they did wellness, and they had an individual who wanted to continue with them and said, this person seems like they constantly have something going on and want me to keep working with them. And I ethically just have a problem with that. And I wanted to say, well, first of all, why did you start your own cash business? Was it to help people get over just their first hurdle? Or was it to treat the way that you wanted to treat and provide them the care that they're looking for? And if you're doing therapy and wellness, why are you concerned about someone wanting wellness with you? That's what you do.
Mm-hmm. That's the school training. That's the insurance training coming out in there. And I've been saying this. You're going to get all my quotes. I don't treat pain. I treat dysfunction.
Yes.
It just so happens when you fix dysfunction, pain goes away.
Shocking.
And yeah. And what do you know? And this is to answer that person's question. It's like, are you going to fix their dysfunctions? Are you going to maintain the good things that you've already given them? Because life does get in the way. People do have medical conditions. I mean, I'm sorry, I'm good, but I'm not like better. I can't regrow cartilage in a knee, right? But if you want to avoid surgery, I could probably help with that. Right. I can help maintain what you've got in a functional, pain-free life, even if you do have a medical condition that kind of wars against our efforts.
Right. David, I'd love to ask you this question. It's based around what we're talking about here, and I love your thoughts. I know you're the interviewer, not me, but I'd love your thoughts on this.
Yeah, ask me questions.
So we through our educational process, we're taught how to differential diagnose, how to treat. Wellness is a part of what we're allowed to do. We're taught how to exercise with people. If we are uncaged, we are taking people on a journey. We're taking people beyond that initial hurdle that they're coming in saying, hey, I need to get over this hurdle. They may have a bunch of hurdles, but that hurdle they're coming in for is the one that's screaming the loudest. But yet we're told to just help them over that first hurdle and that's it. Stop. But with someone like a wellness coming in and like, hey, I want you to help me be healthy. Why is it that there are therapists who feel like, but that is beneath my degree? I must function at the highest level of my degree. It's almost like they're saying, if you don't have a frozen shoulder and I've got a crank on you, then it's beneath me to work on you, to help you. Where do you think that comes from? Why do you think people feel that way?
My initial thought is identity. I think there's a pride in there, and there's a lack of identity. We are servants.
Mm-hmm.
Like you and I, we're servants of the Lord and Jesus Christ. And then after that, I'm servants of people, my family, my clinic, my staff. I don't care if I have to wash feet.
Right.
We should be doing whatever the task at hand is for us to serve others.
Yeah.
I think you probably have a better answer why a lot of people don't want to do that. But very early on, I developed a membership model for our practice, and we have monthly and quarterly sessions. Some people we're keeping them going every month. They can't wait to get in because we can only keep them pain-free for a month, and that I wish it could be better. But this is where we're at. But they were also in terrible situations. Now they are free and uncaged to live their lives. And then some people actually choose to come in on a quarterly basis that are symptom-free, but want wellness because we can treat dysfunction before it becomes painful.
Yes.
And I will tell you, an ounce of prevention is worth a pound of rehab. So let's just keep you healthy.
Mm-hmm.
Let's just double check. We can do that as physical therapists.
Right.
And I think that there's self-limiting beliefs in there that people need to address in their own hearts and minds.
So with that, this just come to me. I would almost argue, or at least put on the table, that perhaps we as a profession continues to or perpetuates or contributes to the brokenness of the system because of the identity that people want to have. Like what you said, an ounce of prevention is worth more than a pound of rehab. So what if we actually helped everybody to just stay healthy?
Yeah.
That's
what we should be doing. And I think to their credit, maybe or maybe not, we'll see. I'm incredibly skeptical and I don't really like the APTA, but maybe to their credit, they seem to be pushing us into that first line of defense, primary care, musculoskeletal experts, and I think that they're trying to create some space for us to be the primary person that you see before you go to your doctor. Your doctor is going to order unnecessary imaging first. They're going to give you medications first, and it's their training, and so I don't necessarily blame them, but it's the wrong thing to do according to all the research. And here we are still in 2026, still ordering MRIs as a first line of questioning and assessment for patients with back pain. And so with that said, I do believe we should be moving into that space. Now look, we in school, we were trained on red flags. We know what to identify. We know when it's outside our scope. All right, we know. Right. Oh wow, you have unremediating pain in your stomach that is nonstop for 3 days, and no matter what you do, doesn't change. Guess what? You're going to the emergency room. You're not. I'm not going to do some visceral techniques on it.
Right, yeah.
Yeah, exactly. I mean, we are way more trained than I think people realize. Mm-hmm. And physicians may criticize us by calling ourselves doctor. And surely we're not physicians. But at the same time, I don't think that patients should be taking rehab advice from physicians either, because the number of patients that physicians have rehabbed are zero.
Correct.
They don't do that at all.
Correct.
And so I think that needs to be this common mutual respect between all the medical providers, and recognizing where our scope is, what we're capable of, and what we're not capable of.
Yeah. And
go on.
I agree, and I think that can be it can be a challenging place for us as a profession to get there, simply because, and you and I, we discussed this a little bit before coming on the air. My opinion is that as a profession, we've always kind of been at the mercy of the medical profession.
Oh, this is your soapbox. Tell us more.
Yeah, I just I just think that I think that as a profession, we have cornered ourselves into being a fear-based profession, a permission-based profession. And, really when you think about it, like, as you mentioned, we're taught to recognize red flags and all these other things, and to sniff things out and to follow the appropriate course of action. Yet for some reason, even though we've been trained to do all this, we have this knowledge, we still fall back to, no, I must ask insurance for permission because I want to get paid for it, but also I don't want them to come down on me. We must ask insurance for permission. I must ask the doctor for permission. And we've been that way for years, probably since when we were back in the 20s or 30s or whatever, when we were restorative nurses before we were physical therapists. It's always been, well, the doctor has the rules. And again, that probably comes from when Rockefeller started the medical profession, and he said, hey, we're going to be the at the top of the food chain here, and everything trickled down. So that it's not that it's impossible, but I think that that's one thing that we are faced against of being able to be on a level playing field in terms of just the conversations. Now, I will say this: there are physicians out there who, they're willing to listen to the physical therapist, especially if a physical therapist, has the confidence, has the clarity, can demonstrate a level of competence where, they can create a conversation that is on the equal playing field. I think it's our responsibility to go to the physicians and nurture that type of relationship, rather than to right off the bat going in assuming or just falling to the position of I'm gonna bow to you, Mr. Doctor, Mrs. Doctor. I think it's going in with the confidence of like, hey, I know what I'm talking about, in a humble way, not an arrogant way, but in a humble way, mm-hmm. respectful way. But when you can demonstrate, when you and I can demonstrate that level of competency and confidence, then we can create those playing fields where we're not having to just bow down to, just be told what to do and be fearful of it.
Do you feel as though it's still a best practice for a physical therapist starting off to go and network with physicians?
You know what? It never hurts to be friends with a physician. It never hurts. Okay.
Mhm.
One starting.
Let me ask it a different way.
Okay.
Is the juice worth the squeeze?
That you know what? A couple of factors depends. If one is a very very niched profession, for example, if you're dealing with like let's say Parkinson's, and if you're in an area where maybe there aren't a lot of options for Parkinson's, and if you are taking insurance, then yes, becoming friends, partnering with physician groups can be extremely advantageous for you because you have identified yourself as an expert in a particular area where there's not a lot of need.
Mm-hmm.
Now, if you are a clinician who is, you love to work with runners, you love to work with golfers. If you're seen as general PT, then it may not be worth it at that point. It may be, I think that it's more worth it to go directly to the consumer because especially if you are cash based, when you go directly to the consumer, then the consumer says, hey, you have the ability to solve my problems. I'm willing to pay for you to solve my problems. But when you go through a physician, now you're hoping that for, let's say that physician sees 100 people in a day. Maybe 2 of those people are runners. You're hoping to kind of capture 2 people out of 100. And because that person has used their insurance to go see the doctor, then they're going to want to use their insurance with you. And now it's a harder sell. It's not that it can't be done, but it's a harder sell. There's a different expectation.
Yeah.
But when I think, or particularly orthopedically, if you can go directly to the consumer and with a clear message, help them to see, just like, with your practice, help them to see that, hey, the Renew Physical Therapy, like they solve my problem. They're filling in the gap. They figured out what's wrong. I am willing to pay to go there because that's what I'm looking for. People will pay what they're looking for, what they are desiring, not necessarily what they need. They may need it, but it's what they want. When a referral comes to us from a physician, it ends up being more of like, well, I'm being told, I don't really want to do it. Can I have somebody else pay for it?
Mm-hmm.
But when it comes from, hey, I've been looking for this, then they want it, they're willing to pay for it.
As a new grad PT or a young clinician, there are 2 things you need: mentorship and money. We will pay you a full salary to be mentored in our customized residency program right here, and it will actually help you fix those patients you could have helped more and prepare you to launch your own business one day if that's something you want. Apply at our website and click Join Our Team at www.renewintegrativept.com, and we look forward to hearing from you then. Yeah, you kind of gave a really good analogy and a comparison between the expectations. And interestingly enough for me, where I got hung up with, so I would consider us as Renew Integrative PT more of a niche. We're chronic pain, and we market ourselves as we fix the things others can't. And I have 2 stories where I had 2 patients with trigeminal neuralgia. We completely cleared their symptoms. If anyone doesn't know this, it's the suicide disease. People kill themselves over this. It's that bad. And I was actually able to clear it out. Shout out fascial counterstrain. It works. And what we did was I had 2 patients that went to the same neurology clinic. And both of them said, hey, you need to know this guy. One of them invited me to her next appointment because the doctor was going to give her refill her prescription. And the PA came in and was like, you don't need medications? No, I don't need any medications. I'm good now. What do you mean you're good? Well, I don't have fibromyalgia and I don't have my trigeminal neuralgia anymore. I'm actually really good. And this is the physical therapist that helped me. And he goes, oh. And we had a short discussion about what it is that I do. And he goes, that's interesting. Maybe we should have you come in and talk to us. I'm like, that sounds great. And I'm thinking this is going really well. And that was the last I really heard from any of the physicians over there. And then I tried to follow up with their marketing person, and she goes, "Oh yeah, no problem. What day would be good for you to bring us lunch?" I'm not kidding you. And I thought to myself, "What do you mean lunch?" She's like, "Well, so and so told me that you wanted to come in and have an in-service luncheon with us." I'm like, "Well, I'm happy to have lunch with you, but I don't know about bringing the whole office lunch. Like, how about we sit down and talk as colleagues?" And she goes, "That's not really what we do." I'm not kidding you. And I thought to myself, that was the last time I tried reaching out to a physician. And it was about a year and a half ago. And it's really frustrating because it doesn't make sense to me, because if I had someone come to me with all these problems and I'm kind of just managing their symptoms, and then the guy down the street just fixed it for them, I would be in their office asking questions immediately.
Mm-hmm.
And I think that there is an apathy in the healthcare system. And again, partly, I'm going to put it on this physician group. They're not interested.
Mm-hmm.
I'm going to put it on them. But then also, I think that the system is so overwhelming that it's hard to take your head out of the sand for a moment and look around and say, "Oh my gosh, what just happened?" Right. I think they're not 100% culpable is what I'm saying. And so it's really hard for me to sit here and say, okay, let's partner with physicians, because a lot of times they don't have the time of the day for us.
Right. Absolutely. When I was back in Phoenix, I got to where, Phoenix, just like Florida, you have your snowbirds. And so I got to where throughout the year, I would average 25 visits a week. So, doing well. And in the 12 years that I was there, I could count the number of referrals that I had from any physician at all in 12 years. I could count the referrals from a physician on the one hand. But I maintained a busy schedule. And the only time that I had to either had someone say no or deal with, say, super bill, was if the person happened to come from a physician. When they came from another source, even if they ask, "Oh, do you take insurance?" and I explained to them that I didn't and why I didn't, "Oh, okay, that's fine. I just thought I would ask."
Yeah.
So again, it all goes down to what problems are you solving? Who are you solving them for? What is your model? If your model is insurance based and depending on the problems that you're solving, hey, you can have a pipeline from the physicians. If it's really more about, I'm really want to just help people, and I want to help them solve their problems, and I want it to be about them and take them to where they want to go, then my opinion is I think you're better off going to the consumers. However, then there are a variety of ways of doing that, but going to the consumers and having a very clear message about what it is that you do and where you take them and what the outcomes look like. Because again, goes back to, everybody has an iPhone, an Android. They're not cheap.
Mm-hmm.
Well, if people were really worried about cheap, why aren't we all walking around with just a Samsung flip phone that you could, or, from Cricket that you could buy for $20? Because the phone doesn't do what we would love for it to do.
It kind of brings up a little bit of my soapbox, is I think a lot of times people aren't willing to pay out of pocket for what they perceive as low quality. And I think I'm just going to put this out there, I think there are a lot of physical therapists that don't get great outcomes. I think in part, absolutely, it's the system. I think having 2 or 3 people in front of you, only being able to do exercise-based therapy instead of some additional manual therapy is detrimental. I think having insurance limitations is detrimental. I think all of that adds to the lack of good outcomes in the physical therapy space. I also would say that a lot of times, we have physical therapy schools that are preaching and teaching that manual therapy doesn't work and it's just a placebo, or it only modifies tissue a little bit to make them feel better for a short time, but the real fix is exercise. And tell that to my patients that can't move. Like, what are you going to do? Like, and honestly, like, it's a big pet peeve of mine. I just believe that physical therapists, if they want to get into this cash-based space or the self-pay model space, you better bring the goods. You better actually have Disney World at the end of the journey. You better make sure that you're selling what patients want. And a lot of times they want pain relief. Now, is there function involved in that? Yes. And is there extra stuff and more goals than just pain? Absolutely. I just believe that a lot of times, whether it's through the schools that are teaching it or the lack of drive from physical therapists after they graduate. You know how many physical therapists don't take con ed courses unless their company pays for it? It's every single one of us. No one just says, hey, I'm going to spend 10 grand this next year on continuing education to get better at this certain skill. Nobody does that. And then you expect us to get these great outcomes. Mm-hmm. Well, we can't, and we expect to get it. We expect people to pay for these outcomes that are mediocre. What is your thoughts on the outcomes that physical therapists are getting now?
Well, great question. First of all, well, I agree with you on the manual. It's funny. We go to school to learn how to use our hands. We go to Con Ed courses, and so many of them, it's how to use our hands to both diagnose and to treat. And you're absolutely right. I mean, is exercise a phenomenal medicine? Yes, it is.
Yeah.
Yes, it is.
Yes, it's needed. Yes.
Absolutely is. But are there times when we need the influence of our hands? Absolutely. I mean, I think, Dave, let's, and hopefully you're okay with me saying this. I mean, I know you personally are, but let's take it back to Genesis 3, all right? Where we're commanded to toil and to work and to use our hands. And so hands, manual is very important, has a very important place. And it's interesting that even though we're trained to use our hands, and that's part of why people come to us, when we're talking about the insurance model, that is the lowest reimbursed thing.
I was going to bring that up if you didn't.
It's yes. Actually doing what we were trained to do. And it's funny, we get reimbursed mostly for doing therapeutic exercise, but yet outside the profession, we're criticized as being just glorified personal trainers.
Well, that speaks to what we're reimbursed for. I mean, that's the bottom line. And I don't know what the exact numbers are now, but exercise is reimbursed about 30% more than manual therapy.
Right.
And so if I'm a business owner, it sounds reasonable to get reimbursed 30%, increasing my margins by 30% just by doing a different treatment modality. And then, by the way, what do you know? You can actually treat more than one person doing exercises, but if you have your hands on one person, you can't have your hands on a second.
Right.
And so it really breeds the multiple patient model in the insurance world where we get paid 30% more and we can double, triple, or quadruple our revenue per hour because of that.
And you're absolutely right. And I think that also just to kind of to address or to answer your question previously a little bit more of how does that influence us or how does it impact our outcomes? Well, if I know that, hey, I'm going to get reimbursed more if I have you do a whole lot more exercises, it's going to influence how I'm treating that person. And it may not be what is right for that person. I'm thinking I am naturally going to think about the dollar bill. Although that was one thing that actually pushed me, going back a long ways in the conversation, pushed me out of the clinic, was being approached with like, hey, if you have your person to do 3 more exercises each time, like this is the revenue that we'll get, and this is how it'll impact your bonus if you have them do more exercises. And so now I'm placed in a position where, again, how I actually take care of someone, am I now just having people exercise, or am I actually thinking about their problem, addressing the problem, fixing the problem? Can problems be fixed with exercise? Absolutely. But there are so many problems out there that first they need some influence before the body part can even move, or needs some influence for a body part to start to feel better before it can effectively exercise. If all we do is exercise, that's only, I like to say we can, you can half bake a pie, but you can't bake half a pie.
so, so So let me give a clinical example of what we're referring to. When I was a traveling PT before I opened my own practice, I was working in a clinic in South Florida. And let me tell you, there was a reason why I was a traveler in that clinic. And it was an outpatient clinic, heavy Medicare and insurance-based practice, very high volume. And I was treating a patient for neck pain. I treated her and I was done with her. I said, okay, goodbye. And she left. And 10 minutes later, I saw her. And she's over there with another, is a physical therapy assistant doing step-ups. Now, again, neck pain, step-ups, just up and down on a step. I was like, that's so weird. What's going on? Miss, Sally, why are you here? And she's like, oh, yeah, the therapist said I wasn't done with it. We weren't done yet, so here I am doing more exercise. I'm like, oh, okay, great. Apparently, the owner caught the patient on her way out, had a PTA that was free for that 30 minutes, and said, hey, why don't you do some more exercise? This PTA did not know her case, did not know anything, and was sitting there doing step-up exercises with a neck pain patient, all for revenue.
For revenue.
And look, I think you and I have that internal battle of like, well, I feel influenced with the bonusing. I was in the same boat as you were, and there's this pull because I'm like, well, I got to provide for my family. And by the way, PTs in the insurance model don't get paid very much. We're professional degrees. We're not hurting, but some people are, especially with the student loan ratios that we were talking about earlier. And I was like, well, it is a battle. And we try our best to be as honest and forthcoming as we can. We're going to really work to be honorable in what we do. But there is that pull and that struggle that is real.
Yeah, absolutely. And honestly, Dave, like in that one situation that I described, I flat out looked at my director and said, I could give a rat's what about a bonus. I cannot justify why a person coming in for a bunionectomy is doing an hour's worth of exercises. Mm-hmm. I cannot justify that. But again, when we start looking at, okay, now I've got to treat according to CPT codes. I've got to treat according to revenue. I mean, hey, I get it. And I respect the fact that businesses cost a lot of money to run. There are a lot of salaries. And like my buddy that just right off the top, he's got to pay $7,000 in rent. I get that. And that's just like probably a far broader conversation of really why the whole system is broken in terms of healthcare, in terms of why we can't just treat people, take people on journeys. But when we start, when a third party starts getting involved, now, like what you said, I love Aaron's quote. I don't work for the insurance company. I work for my client, for my customer. Well, when we start having to work for someone else, doing what they deem is appropriate or is allowed, it influences how I take care of that person. And then, unfortunately, if what the model says, this is how you can treat that person, if for that person, if it's not right, Dave, I know you've spoken to many people when they ask you, what do you do? And you say, well, you mentioned that you're a physical therapist. I know you've talked to a lot of people who said, oh yeah, I went to therapy once. It didn't work. Now, it didn't work for a number of reasons, but one reason can be because, well, maybe the therapist wasn't allowed to actually take care of your problem.
Mm-hmm. Yeah. I always tell people too, I tried therapy, didn't work. I'm like, yeah, it's because you didn't get the good stuff. Insurance does not pay for the good stuff. Do you trust your insurance company to hire the contractor that's going to rebuild your wooden fence?
Right.
No, you don't. You should be the one that picks your therapist. And this isn't, do you trust your insurance to pick the roofers? And we're in Florida. We have hurricanes, right? And I will tell you, like, roofers, like, it can be scammy, right? And especially after a hurricane. And it's the same thing. You really want to make sure that you find the person that you know, like, and trust, and then bring them into your situation for them to evaluate what's wrong with you and then actually fix the root problem.
Absolutely.
All right. So then tell me this, King David Bailiff, what are you doing day one of your kingship to fix the healthcare system?
Man,
Big question. Big answer.
big answer. I'm gonna take it back. I'm gonna take it back to kind of dogging the medical profession a little bit. I'm going to take it back to before the Rockefellers came in and introduced modern medicine and said, "Hey, here's how we're going to create reoccurring revenue, reoccurring visits." I'm going to take it back to before that, when it was about people actually getting better. How I'm going to fix it is I'm going to go back old school. I'm going to build relationships with the person right in front of me, and I'm going to listen to them. I'm going to come with a level of humility, and I'm going to listen to them. I'm going to serve them. And if whatever they need for that day, if they need someone to listen to them, I'm going to listen to them. Well, I'm always going to listen to them. But if they just need someone, if they need an opportunity to just be for a day, I'm going to give them that space to be. Dave, I have helped women in the past get better from severe headaches, where all I did was I said, "Hey, today you're going to lie on this table, and you're just going to relax, and that's what you're going to do." And they come back the next visit going, "My gosh, I've never felt better in my life." Why did I do that? Because I listened to them, and I met them with where they are, and I provided with what they need. And
was that billable?
Just take away the constraints of that. Well, we've got to follow an algorithm.
Yeah.
In some regards, in a lot of regards, like the evidence-based practice stuff is really, really good. It's needed. It's necessary. It has done phenomenal jobs because it's helped us to better understand some things, and it's helped us to provide better care. Mm-hmm. But I think when we get dogmatic about it, I think we get in trouble.
Oh yeah.
I think I've known plenty. I've been around plenty of clinicians that they knew evidence-based, and they were, way smarter than me, but they struggled because if something kind of got outside the lines, they didn't know how to flex.
Mm-hmm.
So I think we need to take the evidence, and the evidence is very important. It's necessary. You've learned the fascial counterstrain stuff. I know a couple other people who do it as well. It is amazing stuff. And learning that and knowing about it comes from research, from evidence. But what I love about what you do with the fascial counterstrain is that it has the space for you to be an artist to deliver that treatment. And so that's where, getting back to, okay, let's take what we know. Now let's be artists. Let's listen. Let's come with a level of humility, and let's really have a mission and a vision of creating just a healthy community. And in doing so, man, we're gonna see happier individuals. We're gonna see happier moms, dads, wives, husbands, happier kids. We're gonna see communities starting to thrive. Maybe the obesity rate that's gone up tremendously in this country over the last 30, 40 years, maybe it starts to come down. Maybe healthcare costs start to come down. Maybe that starts to irritate the pharmaceutical profession and some other people. But we're gonna see healthier people.
You're alluded to is kind of how the modern healthcare system was founded in the Rockefeller era. And if this is a future podcast for me, by the way, but I think a lot of people don't understand what you're alluding to. Mm-hmm. Can you take a moment and explain kind of like what healthcare was prior to that, and then how it changed medical school?
Sure. So prior to the early 1900s, if you've watched like the old Westerns, or maybe if you watched, Little House on the Prairie, things like that, there was always the traveling medicine man with their herbs and their elixirs and everything and whatnot. And they actually work because they were natural. But then the Rockefellers and Carnegies and some other high-powered people who saw an opportunity to make money, they developed medical schools as we know them today. There were naturopathic schools in place, and they learned like how to naturally heal people. For how long, the people who were here before us, Native Americans, back in history, like they had ways to get people better. So I firmly believe that those things work, but those things, they're not revenue generating. And so there was a time when, unfortunately, greed takes over and people want to make a lot of money. So the Rockefellers, they backed developing not only the medical system and medical schools, but they also introduced pharmakeia, pharmaceuticals. If we look at pharmaceuticals, comes from pharmakeia, Greek word, the Greek root of that, or the meaning of that is sorcery, witchcraft. And so it became where, hey, this is how we're going to take care of people. We're going to create reoccurring business. People are going to become dependent on our services, dependent on our pharmakeia. You know what? Hey, those naturopaths, we're going to no, like they're dumb, they're bad, they're not helping people. It's all just woo-woo stuff. Like, they just dogged them because that wasn't where the money was.
Yeah, I think that just to clarify too, you're not talking about the snake oil salesman.
I'm not talking about the snake oil salesman.
Yeah, right. You're talking about the people who use legitimate natural remedies to help people with their ailments. Now, obviously, we've still come a long way in the last 100 years. Obviously, we're better off now than we've ever been. But I think what you're alluding to and what you're really describing is the fact that when the Carnegies and the Rockefellers came in and started, opening medical schools, what they really did is they had an agenda and they scaled and modeled their programs after what would create revenue for them instead of the previous naturopathic type model that we were previously in. Yeah. And unfortunately, there was a campaign against it. And so now naturopathy is a little bit shunned upon or is not evidence-based and whatnot. But you know what else is not evidence-based? Everything that everyone wants to suppress. I don't think anyone is unaware of the fact that the evidence out there for certain things isn't always true. We literally just had the food pyramid turned over upside down on us this last year, and everyone's like, "What now?" Yeah, they lied to us in the 70s. You don't think they didn't lie to us back in the 20s either?
Right.
And now, again, do we need to make sure that we're actually pushing forward evidence-based practice even in the naturopathic world? Yeah, absolutely. Mm-hmm. We can do that, but we shouldn't be suppressing those studies either. They should be funded. We should be funding research for what really causes autism instead of saying, no, not, vaccines don't cause autism. Why don't we just prove it then? Because you can't. At least right now, that's my opinion, right?
I'll let there with you.
I think it's really important that we all have a depends answer to most things. This stuff is nuanced, and we're not necessarily saying that all medicine is bad. That's not true, because there's a lot. If I hurt my leg, if I break my leg, I'm going to the hospital and I'm getting that allopathic medicine. Yes, sir, I'm going there. But we also need to recognize what it is good for and what it's not good for, and maybe some of the roots that are unhealthy, and how do we get rid of that? And it sounds like your plan, if you were King David, you would be going back and saying, hey, let's re-look at these naturopathic ways to actually help heal the body, because what do you know? We were designed to heal.
Yep.
We were designed for it. I always tell my patients that I'm not healing you. I'm just making an environment so that the natural healing ability of your body that God created in you is able to flourish, because sometimes it needs a little bit of a push.
Mm-hmm.
That's what we're doing as physical therapists.
Yes.
And so I think that's an excellent answer. Is there anything else that you would do to change things to get good outcomes in the medical space or the healthcare PT space?
Yeah, I think that it's important that, again, let's look at science. What is science? Science is coming up with a question, questioning or a problem, questioning it, looking at it, coming up with a solution, rinse and repeat, which means questioning it again. So getting back to, rather than everything being so polarized, let's actually have discussions. Let's allow for discussions of like, hey, is this really legit? Does this really work? Does this really make sense? Instead of it being, well, hey, yeah, this makes sense because it fits my agenda.
Yeah, I don't think people realize how much what is published is policed.
Correct.
Right. So you're going to say, well, the studies say this, the studies say that. Yeah. It's also extremely policed. And I think we're being gaslit with some of this stuff. And by the way, there is this natural bias that if that if you're not sure you're going to get the outcome that you want, that you don't publish it, right? Or maybe you do get the outcome you don't want and you go, I'm just not going to publish that because I didn't like that answer.
Right.
That actually happens in the research. And by the way, not every study is designed well.
Mm-hmm.
And, people want us to be arbiters of, truth in the medical field, both not just PTs, but physicians. I mean, people seem to think we have all the answers, and we don't. And what we can do is take the body of work that we know best we can, apply it to your situation. And that's where the art of physical therapy comes into play anyway, is looking at the person, saying, this is what's true in the research. Here's where the biases are. How do I address your problem? For the longest time, the research said that the SI joint doesn't move, and therefore it's ignored. And then when it's ignored, what do you know? When I treat chronic low back pain, the number one thing I treat is SI joint dysfunction. Because the world was told that the SI joint doesn't move or doesn't move enough and can't have a problem. Well, here I am, build a practice around it because of how prevalent it is in back pain world.
Correct.
And that's just one of so many examples of the research being biased. And I don't even necessarily think it's like any one person. It's just it's the system that has been built because of whether it's greed or corruption in one way or another. It is not necessarily the people in it. And I want to make a distinction that, as much as I complain about the system and healthcare outcomes, the reality is I think the system is designed for us to fail in many ways.
I agree. Designed for us to fail, because are there good people throughout the whole system? There are some wonderful people throughout the system. But I think in general, painting a big paintbrush, the system is designed to have things fail.
All right. We're going to end with a rapid fire question and answer. So gird your loins. The first thing I wanted to ask is, and we kind of skipped it over, but I want to talk about good outcomes a little bit more. And you mentioned that you're coaching businesses and how businesses are squeezed in the insurance model. What is the average revenue, the average profit margin that a practice tends to have across the country? Do you know those numbers? And then what is it compared to what you're able to do with your clients?
That is a great question. Now, as far as the actual numbers, I don't know. I can tell you what I know of people who we've worked with that we see on an average. Okay. So on an average, what we tend to see, and I'm speaking more of like, I'm thinking solopreneur. Obviously, as you add staff, hopefully that number goes up. But as solopreneurs, we're seeing people anywhere from 10 to 15K a month as a solopreneur. So now you look at comparing that to if that person was working in a clinic. Now, yes, if they have a space, maybe they're paying for rent. Maybe they're mobile, or maybe they've sublet a place. Again, rent's going to vary all over the place. Yeah. But when you look at that number, it's so much better than the 5 to 6K a month that you're getting in the clinic.
Yeah, I think that truly that's more than double a lot of PTs in the space. And, from a profit margin, I did some research for the show. And what I've found is that anywhere from 10 to 12% is your average physical therapy profit margin. Right. And I think part of it is because of the low reimbursement rates. And I would imagine, and I know just in my practice, the margin's a lot higher, but then I don't think people realize, like, oh, greedy business owner, you have this high profit margin. Yeah. Now with that high profit margin, I can turn around and reinvest into my clinic. I can make better outcomes for you because I can go pay for these trainings, or I can hire clinicians and then, I don't know, maybe train them more intentionally so that you get better outcomes in that regard. And that's actually what we do. So it's funny because I'm looking at my margins compared to the averages out there, and it's about the same. But then if you look at it, half of that margin is gone because of the fact that I'm reinvesting and truly trying to make things better for the clients coming in.
Right.
Next question. Tell me this. What is a realistic expectation for a physical therapist starting their practice to go out on their own? What is reasonable to have a full caseload by? How many months?
I have seen this happen again a wide range. I have seen people go all in, and within 3 months, they were that close to needing to hire within 3 months. Again, there are a lot of situations, a lot of variables that go into that. But I've seen people within 3 to 4 months, they are slammed, and they're starting to say, like, I'm looking at hiring my next person. And
So then what's the common denominator with that?
number one, you've got to have the time.
Mm-hmm.
You have to have the passion. You have to have the belief, and you have to have faith and go all in. And you have to do the work. You have to do the work. And
You mean 4 hours of work a day isn't enough to build a practice?
that's not enough. But I will tell you, and specifically, you asked about common denominators. The people who I've seen, and I know people that in 3 to 4 months they are busy. And when I look at them, I think, how did they do it? What is it about these individuals that they were able to do this? Number one is that they're in a town, in a place where they already have a reputation. They are. I'm going to be frank about it. They are dynamic people. Doesn't mean that you have to be dynamic to be successful, but they are very good. They're very good at talking. They're confident. They're humble. They're confident. They're communicators. But most importantly is they have the relationships, and they know how to build relationships. Those are the common denominators of the people, and they're not afraid. They're not afraid to go out there and go for it.
Mm-hmm.
Those are the common denominators.
There is a level of risk. And you cannot be risk averse and be a business owner. So what's the other side? How long sometimes does it take? And what are the common denominators there?
I've seen it take people a year. I've seen it take people 2 years. We've worked with people, David, in our programs that they've been trying for a year and a half, 2 years, and they come on with us, and a year later they're still struggling.
Mm-hmm.
And honestly, the common denominators really there are you trying something once, and then it didn't work, so you abandon it? Are you even trying at all? Are you creating time for your thing to grow? I've seen people delayed in success, and I look at their situation like, well, I've asked them, when are you going to focus on your business? And I'm not kidding, Dave. I've had people say, well, when it gets busy, then I'll focus on it. Yeah. I said, well, when's that going to happen? Because you're working 32 hours a week at a job, and you're working 3 other PRN jobs. You keep saying yes over here and no over here.
Yeah.
You're not going to wake up Monday morning and just expect a full caseload.
So the common denominator to I would say failures to launch really is the fact that they don't even just put in the time.
They don't put on
and
a lot of fear.
I was going to say it must be fear and anxiety.
Fear,
and just
anxiety,
jumping off.
Which I don't knock it at all. It's very real. I understand where they're coming from.
Mm-hmm.
And even though that is a big part of how we help people, or what we help people to work through, some people they can't let go here.
Yeah.
To trust to go there.
You know, it's interesting to speak to that. I'm one of those people that was hiring at 3 months. But let me tell you what my plan was. So I would consider myself a spirit-led business owner. Mm-hmm. Which means I'm going to ask the Holy Spirit what to do before I do it. And I was in a time of prayer and preparation. And this was February of 2020. I was like getting ready to launch. And I was in the prayer room with a bunch of trusted men that I love dearly in my church. And they were praying over me. And one of them was like, you know what, Dave? I'm just getting the sense that you just need to quit your job. And I was like, no, I'm not. My business plan was by the end of the year to have 10 visits a week. And I was doing home health at the time. So little old ladies, getting them out of the house, that kind of stuff. And I've always been an orthopedic guy by skill. And so I was praying into that a little bit, and I did not have peace about that. I'm like, no way. I'm gonna have 10 patients by the end of the year a week, which would be fantastic for my business plan. And March 9th, I was fired. And the first thing I did is I called my wife and said, by the way, and then the second thing I did is I called my friend. I said, hey, Jim, I was fired. And he goes, okay. You know, Sounds like God was trying to tell you something. And really what he did is he pushed me off the cliff. And I needed that. And what do you know when your back is up against the wall and you're in a corner and you got nowhere to go and you have, I'm not kidding you, I had like 2.5 months of emergency fund. If I didn't make a single dollar, I had to provide, right? And there was a whole bunch of circumstances. And I just think God knew. Dave just needs that push. And it sounds like really what people need to do is just jump in. Like the worst thing that happens is you go get a job in 3 months.
Right.
You know, like that's the worst thing that happens. And, you know, being led by fear or at least prevented by fear. And by the way, that's true for anything. Whether you are a patient, I'm afraid they're going to hurt me. I'm afraid it's not going to work. I'm afraid it's going to be going to be money. It's going to lead to it. They're going to tell me I need surgery. You know, if we are being led by fear or being held back by it, that is no way to live.
No.
And I think that's where you and I, where our faith really comes into play. Like, I was like, okay, God, here we are. I was fired. You told me to quit. Now you fired me and I've got nothing.
Yeah.
And, you know, the Lord shows up.
Yes, he does.
At least I know he did for me, and I know he's done for you.
Absolutely. Well, he tells us, 366 times in the Bible, one for every day of the week. Do not be afraid. I am with you. And if we just, something that I hold on to is just Proverbs 3, 5, and 6. Trust in the Lord with all your heart, and lean not on your own understanding. In all your ways acknowledge him, and he will guide your paths. And I just think about that every single day. You talk about manual therapy. Every day I ask him, magnify the work of my hands to glorify you. And that is my wish for each day is can I glorify you? Because I know he's going to guide me. He's going to direct me.
Amen, brother. David, this has been fantastic. What a way to start off my podcast. I appreciate your insight, your coaching, your mentorship, everything that the Uncaged Clinician group provides, the physical therapy space. Truly, you guys are truly trailblazers. You are breaking trail for so many people. What you did, David, is you took 2 years to figure it out on your own. And now you're turning around and imparting that to others in an amazing way to do it in 3 months. And the blessing that is to people that are that have the wisdom to see it is absolutely amazing. I want to thank everyone for being here and joining us in Good Outcomes, where healing is possible. If good outcomes matter to you, subscribe and follow wherever you're tuning in. If you're a new grad or a young clinician and you're frustrated with the system and its outcomes, go to renewintegrativept.com, click Join Our Team to learn more about our residency program. And remember, healing is possible.